Hmm.
All right, everyone, just going to give you a second to for everyone to get connected here and join. So I'll just let everyone in, and then we will get started. All right. So my name is Julie Challoner. I am the Senior Associate Director of Admissions for our Worcester campus. I oversee the Accelerated Pharmacy program out here, as well as work closely with my colleagues in Manchester and in Boston. I'm joined by two current students today, as well as a faculty member who are going to be going over some information and answering some questions. Before I let them introduce themselves, we are going to go through a short presentation, as well as have some prepared questions here. If you have a question that you would like to ask, there is a way to ask the question. And the question and answer spot. So just make sure to type that in, and we will be happy to answer the question at the end of the presentation that you may have. This is also being recorded, so if you would like to get a copy of the recording, you are welcome to reach out to me. My contact information will be at the end of the presentation, and we'll be happy to send that out. So I will have my panel introduce themselves as well. We can start with Dr. Conway Allen.
Okay, hi everyone. My name is Dr. Conway Allen. I'm an associate professor here at MCPHS on the Worcester campus. This is also my alma mater, so I'm happy to answer any questions that I can for you for those that are looking specifically at the Worcester Manchester program. My areas within the university, I'm in ambulatory care, so I take students on rotation here. I run a course in your first year that does a simulation lab, and I teach at various times throughout your second year as well. So we're going to be able to tell you all about it, but excited to see you all.
Then we'll go Krishna and then Bridget.
Hi, everyone. Thanks for joining us. My name is Krishna. I'm a second year pharmacy student. I'm at the Worcester campus, and I am from Alberta, Canada.
I think Bridget is frozen.
Oh, maybe I think she may have been having a little bit of connectivity issues. She'll probably join us back in here in a minute, but Bridget is a first year student. So you get to hear. Oh, there she is.
Oh, can you hear me?
Yep. She may need to exit back out and come back in to reset. But Bridget is a first year student when she joins us here at the Worcester campus as well. And if I'm not mistaken, if I'm remembering correctly, she is local to the Worcester area. So we'd just like to get started with some information about pharmacy, so just some fast facts for our students here. We just like to list off, the minimum annual wage of a pharmacist in terms of what potentially our students be looking to make when they graduate. Obviously, the statistic is just a medium. It is really going to depend on where you live, what kind of pharmacy you go into, what you're looking to do once you graduate. But we like our students to know that once you do graduate from our program, our students are going out into the workforce and making a decent salary, particularly after you've invested, 3 or 4 years into a program. It's good to know that there is a return on that investment, as you can see there. Bridget, you're back. Can you hear us better now?
Yes, I can. Sorry about that.
Okay, you want to go ahead and introduce yourself? Just you can jump in here.
Sure. So my name's Bridget. I am in my first year here at MCPHS. I am on the Worcester campus, and I am local. I'm from Harvard, Massachusetts.
Great. Thank you so much. In terms of MCPHS, we are a healthcare university. We specifically focus on healthcare, across our 3 campuses, as well as our online programs. We have over 100 programs that focus on a variety of different fields, including pharmacy itself. Many of our students are finding job placements after they graduate. I talked to some students back in the spring at one of our visit days, and they had already had some positions lined up. That visit day was at the end of April, so they were getting ready to graduate, and a lot of them already had jobs lined up for once they did enter the workforce. So, again, students are investing, 3 or 4 years in their education, depending on the type of pharmacy program that you attend, but they are getting jobs once they do graduate. In terms of the pharmacy landscape itself, I'm going to turn it over to Dr. Conway Allen to talk a little bit more specifically about the pharmacy landscape and what they're seeing, since she's involved in it every day.
Yeah, so I mean, this slide's obviously important for a series of reasons, right? Everyone wants to make sure that they're going to invest their time, their energy, and their money into something that hopefully will have good results. So this slide is really helpful in that sense. But one thing that's really helpful too is to think about what area or, what is happening in pharmacy just in general in the States. And so we're noticing that we've got some different roles now than we did just many years, not that many years back. And primarily that's because of COVID, to be honest. When COVID hit, the pandemic hit, it was pharmacists that really had to take a really predominant role with vaccinating patients, with being at the forefront in the public space with individuals who are less likely to go to doctors' offices, different stipulations associated with travel and the like. And so pharmacists really sort of plunged forward at that time. So now what we're seeing with pharmacy is sort of the realization, but from all of healthcare, is the important role that pharmacists actually play. So pharmacists are getting jobs in hospitals, in industry, in research. We've got graduates that are going into PhD programs and other postgraduate. We'll talk about some of those things as we go, but basically the reason why this is important is just to know that the areas and roles in which pharmacists are stepping into now have really, really expanded across different healthcare scenes, across artificial intelligence and technology related landscapes. And so the jobs for pharmacists are ever growing and ever changing, and really allowing for a lot of great opportunity and creativity when it comes to what area of pharmacy you might be interested in.
So we have 3 locations, and all 3 of our locations do have a pharmacy program located there. So our Boston location is kind of our flagship location. It was founded in 1823. It's located in the heart of Longwood Medical. This campus primarily has a lot of undergraduate programs. We have a lot of students who are coming right out of high school. They don't have any college credits. They're looking to come in and potentially do the pre-pharmacy coursework that's required to enter into a professional pharmacy program, or they might be majoring in some other type of bachelor's degree program. Maybe they're pre-med, they're looking at healthcare administration, health psychology, something like that, and then potentially moving on to a graduate level program once they graduate. We decided to offer some more graduate level programs and opened up our 2 additional campuses, one in Worcester, where I am currently located, as well as the panel here, and then one in Manchester, New Hampshire. Our Worcester campus, essentially located, if you were not familiar with the geography of New England, we are about an hour west of Boston. So we are located in the heart of Massachusetts itself. Worcester is the 2nd largest city after Boston, so it is a pretty bustling metropolis. But I always like to say we get a lot of the advantages of living in a city in terms of shops, walkability, and things of that nature, but you don't have some of the drawbacks like the traffic that you would get in another major city like Boston itself. Here in Worcester and in Manchester, we offer an accelerated program. We'll get into that in a little bit. And then Boston offers more of your traditional 4-year program. And then Manchester, New Hampshire is a little bit north of Boston. It's probably about an hour north of Boston and a little over an hour north of Worcester. It's a little bit of a smaller city, and our campus is a little bit smaller there, as you can see by the numbers that are advertised. But again, they also have, lots of shops, restaurants, and things like that. So regardless of the campus that our students attend, they always have access to everything that a city would offer. I'm going to turn it over to both Krishna and Bridget to talk about, kind of why they chose the campus that they did, and then kind of what are the things they like about, I know they're both in Worcester, so the Worcester area. So we can turn it over to Krishna. Obviously, you can great to hear a perspective from somebody who is local like Bridget, and then somebody who was not like Krishna.
Great, I can definitely start us off. So as Julie said, I'm not from Worcester. I'm actually from Canada. I moved here for my postgrad, my post-secondary studies, and my reason for choosing this area was mainly because of the saturation of large drug companies that are in the area. I've always had an interest in research, and I do think that I continue to have this interest in research, and I hope to pursue a career in research in the future as well. The area is just known to have what like the largest drug companies in the world. So yeah. Something I want to add about Worcester that I actually didn't know before was that it does have a lot of green space. I like to go for runs. There's a lot of great places to go for runs here. So I like that. I appreciate that as well.
And in surrounding areas, Krishna, I'll have to give you some good trails and run spaces all around the reservoir and whatnot. So I'll give you some spaces.
Yes, please. Thank you.
I live pretty much equidistant from the Boston campus and the Worcester campus, but I ultimately decided to go for the Worcester campus for a couple of reasons. Probably the main reason is that it's an accelerated program. So instead of having summers off, we take classes during the summers. And for me, I just figured I'd rather be taking my classes in the summer than having to work 40 hours anyway. And then another reason why is I have a friend who's in the nursing program here, and she talked about how all of the professors that she ever had were super involved and really cared about student success. And so I had hoped that would carry over to the pharmacy program as well. And I can definitely say that has. You know, your professors like really care about you as a person and then as the professional that you're going to be. So I've really enjoyed getting to know them, getting to go to office hours, and they're always willing to help.
We do have two types of programs that we offer at our campuses. So in Boston, we offer what we call a direct entry program. So basically what this means is this is a program geared towards individuals who have already done either a bachelor's degree or done 2 years of pre-pharmacy coursework. So that's the prerequisites that are listed on our website. And they're entering into the professional years of the program. So they're focusing on that pharmacy level coursework. So it is a traditional fall and spring semesters. There is no summer semester, so our students just attend a traditional fall and spring calendar. For students who are maybe not finishing yet the pre-pharmacy coursework, maybe you're thinking about pharmacy school or you're in your first year of college, you can enter Boston to finish out those pre-pharm courses. They have a couple of different options available for students depending on how many courses you have, how much college credit you have. So there's a couple different options in Boston that you can kind of pursue there. And they kind of can guide you in how long it's going to take, what are your different avenues and things of that nature. At the end of this presentation, my colleague Ryan's information will be posted, and he would be the person that you would reach out to answer those questions. As depending on your situation, it could be very individualized. We then offer an accelerated program. Again, it's very similar to Boston where you have to have the prerequisites completed to enter the program. So you could have, again, a bachelor's degree, or you may have done just those pharmacy prerequisites that we require on our website, but those do need to be completed. There is no pre-professional entry area. So you can't come in and complete prereqs or anything like that. That is only available at Boston. We are an accelerated program because we have 3 semesters. So we have a fall, a spring, and a summer. That is the main difference between Boston and the Worcester Manchester campuses, besides obviously physical location. So what that means is you do 2 years in adaptive classroom-based learning, and then there is in the final year of the program, your advanced rotations. So we will go into a little bit of a Q&A here to talk about the programs and kind of the different things that we offer from both the student and the faculty perspective. So starting off with the students, one of the things that we really like to highlight at our university, as I mentioned earlier in the presentation, all of our campuses focus on some type of healthcare or life science program. And because of that, we focus a lot on interprofessional education between the different departments, the different healthcare careers. So I want to turn it over to the students to talk about maybe a IP event that they have participated in since they've been here. And either one, you can start, whichever one wants to go first.
I can start. So I've had the opportunity to do 2 IPE activities so far. And one of my favorites was the roles and responsibilities event that we had. We got together with students from all the other programs at the school. and we were able to go through some situations. They were like, our patients, and we went around the table, different ways that each of our professions could contribute to improving the patient's outcome. And it was really fun getting that opportunity to see things I didn't know about other programs. So, for example, I didn't know that occupational therapists can do wound care on the hands. So there was lots of cool things that you learn that you will be able to take into practice. You can recommend it to your patients in the future. And it was just a really fun opportunity to also meet other students on campus.
I definitely agree. It's so valuable having so many different graduate programs in the same area, but sometimes we feel like we don't really get to see each other that often. These events, like for example, we had one that hosted by our school and also UMass, which is a medical college nearby. It had, for example, like the MD students and all of our PharmD students. We were all talking about the different roles, just as Bridget said, the different roles that we all play in the same team. I think it's really valuable for the fact that we're all going to be in the same team. We all have different roles, but they're like pieces in a like a train track. It really gets you to your destination. That was really something valuable that I learned there.
Dr. Conway Allen, do you want to add anything as a faculty member and kind of facilitating some of these IPE events?
Yeah, I would love that. And I love that you brought that one up, Krishna, because I'm actually facilitating multidisciplinary rounds through an IPE event through MCPHS and the UMass Medical School tomorrow. We've got two different sessions, morning and afternoon noon sessions with hundreds of individuals across all sorts of disciplines. And tomorrow's IPE session is actually with a strong focus on professional ethics. And so you'll see these really heavy sort of topics that we need to have conversations about. And now you get a chance to have those conversations, not only with your peers in pharmacy or whatever your actual discipline is, but just within the university across all sorts of healthcare professions. And just as Bridget had mentioned, and I fortunately get to participate in all of these IPE events as well, the roles and responsibilities activity, even though I participate in it every year, you're reminded about the different roles and tasks and responsibilities and certifications and things that your other folks are working with, that they're right in a desk right next to you. You're working with a nurse, you're working with a PA. Being able to have conversations and work with them as a student only is going to make it better for when you go out and you're actually working on these teams in the actual field. And then you're going to be very, very well suited to work on these multidisciplinary teams. So we have entire committees that are devoted to IPE that work within the institution, within our School of Pharmacy, within the university. So across all of the programs, so dental hygiene, optometry, occupational therapy, PA, dental hygienes, medical sonography, you name it. And then outside of our institution, we then do these IPE activities with other learners through the other medical and nursing schools in the area. So a lot of really wonderful opportunity to expose our students to these multidisciplinary or interdisciplinary teams as students. And then they ultimately will do that again when they're on rotation and then ultimately in practice.
Great. So one of the other questions we get a lot here from, prospective students as they come is kind of the organizations that we offer on campus, specifically professional organizations that our students can get involved in. And I know, Krishna, you have been involved in some organizations, I think, here in the year and a half you've been here. So do you want to talk to maybe one that you've been involved in? And Bridget, if you are involved in any as a first year, if you want to chime in after her, that'd be great.
Yeah, definitely. I can start us off. So I have always had the interest in research as well as in like substance abuse. Back in Canada, I know it's also an issue here, but in Canada, in the Western coast, it's really quite a big issue. So here at APHA, I'm the chair of substance use disorders. And then at IPHO, which is the industry pharmacy organization, I am the vice president, and I'm also the president at ASCP. We focus on making sure that patients that are patients that maybe have a lot of medical conditions or patients that are a little bit older that struggle to find the care that they need. We just want to make sure that they are getting the care that they deserve as well.
Yeah, I have had the opportunity to go to both the APHA and the IPHO organization meetings as well, both of them that Krishna mentioned. And it's really great, especially as a P1 or like a first year, that they've been so welcoming and they've really helped pave the way for understanding what is going to be involved with our classes. They've really helped us get to know some of the P2s or the second year students. So it's been really great from like day one when they started inviting us to the meetings. You really get a feel for what it's like to be a student at MCPHS.
And I will happily comment because I also am an advisor for two different organizations, neither of one of what Krishna and Bridget mentioned, but I serve for the advisor for ASHP. We call it alphabet soup. We have so many different organizations and they all have so many different letters associated with them. So I also am an advisor for ASHP as well as our Rokai National Honor Society. And I mentioned those just because, again, I'm highlighting also the fact that, you know, students and faculty really do work together to try to maximize that student experience. And so student organizations is one way that we do that. So through these organizations, we have guest speakers come in. Maybe you're a first year student and you're not sure what area of pharmacy you're interested in. And then ASHP happens to have a panel come through where there are three different pharmacists talking about their different areas of expertise. And that right there might be the trigger that actually, you know, kickstarts your thoughts about what you want to do or what area you want to work in pharmacy. Maybe one person comes in and gives a talk about their what they do as a pediatric pharmacist. And now all of a sudden you realize pediatric pharmacy, that might be the area for me. So these student organizations not only do good things with community service and bring students together, but they also help for students to get exposure to different areas of pharmacy, to speak to different people, to network, to attend different things. So we attended through our Rokai, we did the Walk to End Alzheimer's Disease, and there was a whole slew of us there, as well as folks to the Consultant Pharmacist Organization, and we were all there on the weekend, dressed all in purple, the beads and all the whole shebang, having a great time, working together through the student organization, but ultimately for a good cause and still healthcare related. So a lot of opportunity to get involved on campus, a little bit different from undergraduate just in its nature because it's a professional program, it's all year round, right? It's a little bit different, but some of the same, intentions are there, right? The intention to still bring you together, to expose you to folks, to expose you to different people, and to feel really, truly like you're a part of our community.
One of the things our students are definitely, one of the questions that we get asked a lot, and I think one of the focuses is on clinical rotations. So I know Bridget, she's a first year student, so she hasn't yet gone out on clinicals. They start in our second year of the program, but Krishna has definitely done her initial rotations. Here in the fall, they do two, one in community and typically one institutional. So Krishna, do you want to talk maybe about which one was your favorite rotation out of the two that you did?
Yeah, definitely. So speaking as someone that has really never had any pharmacy experience before getting here, it was very unique. My institutional was at UMass Memorial, which is a hospital, probably like 10 minutes walking distance. It was really quite great. I had the opportunity to go on rounds. I got to see a C-section for the first time. It was really quite cool. I got to do sit downs with a team of doctors and residents as well. We just discussed different patients and the medications that they were taking, or maybe why they were still taking them, or maybe if they needed to take them. It was really quite great. My community was at Family Health Center, which is I'd say it's like a clinic nearby. I was in the outpatient setting. Maybe you guys know what that means because I didn't know what that meant before getting there. Um, but yeah, it was a population of a lot of different languages. It's quite unique to have so many different languages at one clinic, and we're always like um looking for the translators, but it was really cool. Yeah.
Bridget, what are you looking forward to going out on rotations for? I usually always ask that because do you guys know where you're going yet? I always forget when you guys find out. No, not yet. Okay. I know it. Usually by the time I do this in April, everybody like knows and it's, it's easier.
Yeah, it just closed today for ranking for them, so I guess we'll find out soon. I'm definitely looking forward to both of them because same with Krishna. I have not had pharmacy experience. I did work in a hospital during my gap year, but not in the pharmacy. So I'm definitely excited for my clinical rotation because I already have had like that hospital experience. So it'll be cool to see like from the pharmacy perspective. But I'm also looking forward to community because I think it will help bring in a lot of what I've been learning, especially in like IPC with Dr. Conway Allen and all of that. So I'm excited to dip my toes into both.
I could give a few comments about rotations as well. So all of the faculty that are here that are pharmacy practice faculty, we take students on rotations at various sites. And so they might be in community, which would be your CVS, your Walgreens, your independent pharmacies. It will be institutional. So that's in the actual hospital pharmacies, checking IV bags, sending orders up to the different floors. There's internal medicine rotations. These are, again, I'm sort of mentioning these at the tail end of your academics here at MCP. So this is for your advanced rotations, which are what Krishna will be going on in about, I mean, I guess how long, right? In August, right? In August, you'll be going on your advanced rotation. So internal medicine rotations are when you would get to do some of the things that Krishna got to actually already explained, that she got to watch a surgery. That's not super duper common, but really, really cool that she had that opportunity. She got to go on rounds. So she's literally going bedside to bedside with a whole team of physicians and students and nurses and behavioral health and caseworkers. And they're all, checking patient to patient. And then you'll also you'll do a rotation in ambulatory care. So that is more of thinking about going to your primary care provider. You have 10 different conditions because you're on 20 different medications, lots of conversations to be had with pharmacists. And so I am the pharmacist at these types of locations. And so my students will be a big part of taking care of those patients. So just sort of highlighting that the rotations are in so many different areas. In addition to that, they might be in specialties, maybe pediatrics, oncology, or cancer. Maybe it's in governmental, maybe it's an administrative or a managerial type of rotation. Maybe it's an academic rotation where you're helping one of us as faculty in our compounding lab. So the opportunity for rotations is tremendous, and we have such great ties with so many different institutions, pharmaceutical companies, hospitals, pharmacies, outpatient settings, universities, hospital systems, all in this area. And so you do have a great opportunity to have a really excellent rotation experience.
Great, thanks so much. Dr. Cohen, do you want to talk a little bit about some of maybe the things people have done post-graduation, maybe a residency, fellowship opportunity? Obviously, Krishna and Bridget aren't quite there yet, but I'm sure they're thinking about what they want to do eventually, but maybe from the perspective of what have past students done.
Sure. So after pharmacy school, right? That sounds great. Many people are perfectly pleased and ready to start their professional careers, and some decide that they want to do additional training. And that additional training is usually in the form of either a residency or a fellowship. So the difference between the two: residency, think of more clinical, hospital-based, and fellowship, think more of clinical trial industry, pharmaceutical company based. And so what our students do, and actually they get a lot of assistance through different organizations, is we try to make sure that students that are interested in that post-grad training have resources and opportunities available to help assist them as they're working through that. So they might be assigned a mentor who will help prepare all of their postgraduate research, and when they're getting ready for interviews and applications, there might be someone helping to prepare or give them sort of feedback and guidance in that respect. I'm so very sorry. Can you continue, Julie? I have to step away from just one moment. I apologize.
No problem. So we'll talk a little bit about the application process and how things are going. So in terms of the application is currently open regardless of the program that you want to apply to. So whether that's the Boston program or the Worcester or Manchester programs. The deadline for those programs is currently June 2nd. So we got a little bit of time here, but we always recommend that students apply before that deadline. It can take a little bit to get everything into FarmCast and have them verify your application. It also gives you more time to kind of, go through the application process and all of that. So you apply through FarmCast, and you would send them all your information. So you do need to send them transcripts from all the schools that you attended. Even if you just took one summer class at one community college, you do need to send them that transcript or they won't verify your application. There is a separate application for all three campuses. So Boston, Worcester, and Manchester all have their own application. I always tell students, please don't apply to all three. FarmCast will let you apply to all three. They'll be more than happy to take your money because it goes to FarmCast, not to the school. But ultimately, we are going to ask you which campus you're most interested in. So it's kind of a waste of your money to apply to all three. So just pick the campus you're most interested in. If you have any questions about the programs themselves or maybe where you fit in, that's definitely a question to ask either myself or my colleague Ryan, and we're happy to direct you. We do require one letter of recommendation that you can submit through FarmCast, as well as there is a personal statement available as well. But everything would go through FarmCast. The only difference would be is if you are somebody who's thinking about coming into Boston to finish out your prereqs or do prereqs, then there is a separate application for that. And I would encourage you just to contact Ryan, as he would be happy to help you.
And sorry about that, Julie. I am back now. I very much apologize. But just to really quickly just round out just sort of my thought just in regards to postgrad, essentially just if you have ever had thoughts about continuing to, if you've ever read or researched in any capacity about positions in pharmacy, you may have seen the term postgraduate training, residency, or fellowship, but just know that those types of things we would expose you to, assist you with, help provide you with a mentor or someone to help guide. And then, of course, the connections and whatnot that you make. Several of us are involved in those postgraduate programs in different ways. We might be your references for letters of reference or recommendation. And so once you come in here, don't worry too much about having to have it all figured out about where you want to go with your pharmacy degree. But just know that there are a lot of different opportunities and we will make you privy to that information.
So as I mentioned, the deadline is June 2nd. What we look for in terms of when we're evaluating an application, we're going to look at your overall GPA, your overall science GPA, as well as the prerequisite courses that you are required to take. Please know that we do use FarmCast GPAs, so it may be slightly different from your transcript depending on, what you've done in your school, if you've taken a class more than once or something like that. So just keep in mind that we do use FarmCast GPAs. We're also going to look at any experiences you have. Now, this could be pharmacy specific, but as Krishna and Bridget both said, they didn't have prior pharmacy experience coming into our program, but they may have had healthcare experience, healthcare exposure, so definitely list that out. You can also list out even things that are not related to healthcare. If you're working full-time, that's helpful for us to know, any organizations you may be involved in at your current institution. So definitely list it out. As I always say, we can only go based off what's on your application, so it's better to list it out and let us evaluate it than to leave it off. There's the essay, so your motivation for why you want to attend pharmacy school. And then also there is the letter of recommendation. We kind of look at all of that when making some basic decisions. We then will have an interview component. So both Boston and Worcester Manchester have separate interview components. For the most part, we do offer virtual interviews, although there may be some in-person opportunities depending on when you apply to come here on campus. Boston does have a writing sample that you would receive information about if you were to interview for Boston. And then just some quick highlights. Courses can be in progress, missing, if you're finishing out a degree, anything like that when you do apply. You can list all of that out on FarmCast, although they would need to be completed prior to starting any program here. So they would need to be completed sometime in the summer. We do require a grade of C or higher, so just keep that in mind. If you have any questions specifically about your prerequisites or your situation, or if you have AP credits or older courses or anything like that, it makes sense to reach out to your individual admissions counselor separately, and we can answer those on a one-on-one basis. However, I am going to turn it over to Dr. Conway Allen, as she sits on our admissions committee for the Worcester Manchester program, and she can kind of highlight what are some things that the committee maybe looks for in terms of a competitive applicant.
Yeah, so of course, GPA, grades, course loads, and the like. We obviously need to look at you objectively as a student because we are, a doctorate program, and your ultimate, final degree is a terminal doctoral degree. And so it is a professional program, which means that it is rigorous. And so we do look, of course, on your academic prowess and your ability in that respect, but we really do take a look at the entire candidate. So not only is it lovely if you have, healthcare experience or hospital experience or anything in that area, but we love any experience. Where have you worked? Where have you learned leadership skills? Where have you volunteered? Have you traveled? Where have you been put into, situations or circumstances where you had to adapt? How have you had to show empathy, right? Like we want to talk to you about who you are, where you've been, and why you want to be a pharmacist. And that can look different for all of our candidates coming through here. So please make sure you're ready to talk to us about your story, highlight who you are, highlight what you know about yourself, and just make sure you're ready to have a nice conversation where you're ready to sell yourself, meaning you want us to understand who you are so that we can make sure that it's a good fit for our program. But in addition, we want to make sure that our program is a good fit for you. So come with questions, do your research, right? Make sure you look online, make sure you look at the right program, make sure you're taking a look at what your campus in particular has to offer. So if you have questions on your interview, you're well suited to ask those questions. In addition, since most of these interviews are virtual, we do encourage students to pay attention to the actual process of a virtual interview. So what does that mean? So just a few moments ago, you saw that something distracted me. I had to get away for just a moment. Now that was an urgent situation, yes, but obviously trying to minimize those types of occurrences is good, right? So making sure you're in a location where you've got good Wi-Fi, where you are not going to have people walking, back and forth, either behind the computer screen or behind you, making sure that you can hear, making sure that you're considering it to be just as any other interview, as if you were in person, just making sure that you're considering it to be the same, dressed professionally, having good questions, making eye contact as best as you can, considering that often we're using two screens. So just be mindful that the interview is really a time for you to talk about who you are, because all we have ahead of that is your application. So we only have you on paper. So when we have you in front of us, it really is the opportunity for you to shine, to tell us about who you are, to tell us why MCP is where you should be, and then ask those questions so that we can hopefully come to the same conclusion that this is where you should be.
So in terms of financial aid, everybody is considered for our merit scholarship awards when they apply. There's varying levels, but we consider you automatically. So you don't need to fill anything out. There's no supplemental application. Everyone is just automatically given a shot at these awards. And 100% of students do receive something from a merit scholarship perspective. If you are a domestic student, you are welcome to fill out our FAFSA through the U.S. government, and they will provide you with what you may be eligible for from that perspective. Luckily, we do have a whole student financial services office. They work with students on kind of their financial availability. What are you looking at after your merit scholarship award comes off? What are you looking at in terms of a year-over-year cost? How much do you think you're going to need for living expenses? Krishna lives here on campus. Bridget commutes. Their living expenses are probably going to be different. So they kind of go over all of that with you. And they will also do phone appointments. You don't necessarily need to come see them in person. They're happy to speak with students there. So definitely we can get you in touch with them if that's something you are interested in. In terms of contact information, here you can see the contact information for our 3 campuses. As I mentioned earlier, I am the contact for Worcester. Again, my name is Julie. My colleague Amy is the contact for our Manchester campus, and then Ryan is the contact for Boston. Please note his email is a little bit different. It goes by Kenneth Dana, so just make sure you email Kenneth and not Ryan, or it won't make him there. We also do visits here, so you can sign up for individual counselor appointments on that visit page website if you have a question for one of the counselors. You can also sign up for tours. We do campus tours So you can sign up for one of those on all 3 of our campuses as well. However, I do want to highlight for Worcester and Manchester, we are coming up on some visit days here in the spring. So for Worcester, it is going to be on March 29th. And then for Manchester, it will be April 4th. This is a really great way to come see our campus in a much more robust way. We will have program presentations. We will have a welcome. Our housing units will be open to view. Current students will be there. So it just we'll also have financial aid. So it really gives you a great opportunity to explore the whole campus and talk to a lot of people at once, as opposed to just coming for a campus tour where you may or may not get to see, these people depending on who's on campus, what time you're coming. Students may be in class, so we may not be able to show you every classroom or a lab or something like that if they're using it. So again, we highly encourage students to come to these visit days, as you'll get a more robust experience at them. So again, if anyone has any questions, there is the Q&A box that you can type them into and we can answer them. We're waiting to see if any questions come in. I am going to ask our panelists here a question. So for the students, what is one piece of advice you would give a future pharmacy student? Obviously, you guys are both, kind of in different places in your pharmacy education, but what was one piece of advice you give to a student that's thinking about attending pharmacy school? We can start with Bridget.
I think one of my biggest pieces of advice is if you get imposter syndrome easily, like sometimes I find myself doubting myself, remembering that you made it through your prerequisites. You obviously have passed a lot of these science classes. You know the basis of the information that you need to know, and not letting that doubt get in the way of thinking like if you should even apply or when you get here, if you should even walk through the doors, because you've obviously made it this far and you can go even farther.
And Christian?
Yeah, definitely. I agree, Bridget. Something that I was actually told during one of my info sessions was that you have to accept that you will be busy. And, you all we all know we are busy, but then it's like after you get here, you really start to understand that there's school, there's everything outside of school, and then it's like managing your life as well. But yeah, I just try to make sure everyone knows that they are going to be busy and everyone else has done it too. There's so many generations of students. I mean, Dr. Conway Allen is a professor now. So yeah, we've all done school before and yeah.
Conway Allen, can you give an idea of why a student should pick potentially MCPHS? You obviously attended here as a student and now you are a faculty member here. So clearly you have enjoyed your experiences at our school, but what's maybe something that sets us apart from other pharmacy programs?
Absolutely. I think there's a lot of things that set us apart from other pharmacy programs. So one thing that, when we were sort of talking a little bit earlier about different things within our actual program, one thing we didn't really touch on too much is that we also have a lot of additional opportunity for those students that have additional interests or desires. Krishna mentioned how much she likes to do research. She currently does research with some of our colleagues. So she has posters and works on manuscripts and is doing different things because of her interest. Which is something that's really important. We have different concentrations. So you can have a geriatric concentration. There's a pediatric concentration that was just recently approved that is in the process of coming to the fruition. Please note, I'm talking just about Worcester, Manchester right now. I'm not talking about Boston. I'm only talking about Worcester, Manchester. But we have certifications. We just did our immunization certification. So all of our students right now are certified to immunize. So when they go out on rotations, they've already got employers that are working at these different pharmacies now interested in these candidates because they're already ready for the job, including things like immunization certification. We do MTM certificate opportunities. We also do a diabetes certificate program that folks can do. There are different, cancer research electives where you can sort of go that route. If you want to go a biotech industry route, you can go that route as well. So there are different things in that respect. The student organizations absolutely set us apart because you're right here and part of a community and being involved in professional organizations from the get-go. Just just our location, right? We are the second largest city in New England, here in Worcester, Massachusetts. Manchester is a vibrant city in New Hampshire. And so, but we're still connected. We still are great with our colleagues and our peers. We work together in various different ways. So I think the community, the constant quality improvement that we do, I saw it as a student. I continue to see it as faculty. We're constantly working on ways to improve our assessment, to improve pass rates, right? We most recently implemented entire new changes of review sessions and exams that take place throughout the final year to continue to prep our students to pass the boards. And now our students are doing much better than what was sort of happening after COVID, which was a little bit of some issues with some different schools. And we are above the national average again, as we should be, because of our continuous quality improvement and trying to make sure that we are putting our best foot forward. And our goal as faculty and students are one and the same. And for me, I think that community and sense, and again, I don't want to say continuous quality improvement, but that's what we're doing. We're always trying to improve and make things better. And I see that from the faculty side. I hope the students see it from the student side. But I think that one of those, just that community and that sense of belonging is one of the reasons why I continue to obviously hail the praises of MCP, because I am a graduate, did a residency through the program affiliations, and then have been faculty for a very long time. Yeah.
Great. So one of the questions I got was about test scores. We don't require any test scores at this point. I think at this point, correct me if I'm wrong, the PCAT has been phased out entirely. I think it was being phased out during COVID, but I think at this point it's no more. And we don't require like a GRE or anything like that for any of the campuses. So I wouldn't recommend taking it unless you find a program that requires it, because we won't even look at your scores, even if you submit them. If you are coming from the Boston campus, I had someone ask if they are currently an undergraduate at the Boston campus. In terms of financial aid, we would talk about that when you get to that point. It really depends on kind of what your situation was like in Boston and what it is here. But you would be considered for the scholarships for Worcester and Manchester. You wouldn't necessarily not be considered because you're coming from Boston. It's just more of a complicated answer because it really depends on your personal situation. But we could certainly get you in touch with our Student Financial Services office at that point. Where can you find the requirements for the programs? They are right on our website. So there's a couple different options where you can find them. If you actually are on PharmCast's website, you can search for any school that has a pharmacy program, and all of the schools are required to list out their start date and the prerequisites that they require and all of that information. So that's a really great place to find it in a very compact spot, because you can find both the Worcester Manchester programs and the Boston program requirements listed there. And then they're also on our website. And you will see them out listed, one for accelerated and then one for the direct entry Boston program on there. Again, the prereqs are really the important piece. Just keep in mind, there is a slight difference between the three programs, as well as depending on what kind of degree you have. So again, just keep that in mind. You can certainly reach out to us if you have a specific question about your background there. So one thing that is unique here about our school, someone asked about, do we use TAs or research assistants? We actually don't. For the most part, our classes are taught by full-time faculty who work. They may still work in the field. Like Dr. Conway Allen said, she still takes students in the field, and we have other faculty who work at sites. But we don't really use, as far as I'm aware, we don't really use TAs or anything like that. I know we've had some people like proctor exams and things like that, but am I correct in that? And most of the time, students are volunteering for research opportunities or maybe involved in campus activities, but they're not actually working as like a TA.
Correct. There are no TAs, but there are tutor opportunities to be for students that do well in courses, to potentially tutor for students lower than them, or so P2s, tutoring for P1s. Yeah.
Yep, we do offer that through our case center, our Center of Academic Success and Excellence. It's a mouthful. They will offer tutoring services, so you can either take advantage of those services. You could obviously sign up to be a peer tutor. There's other ways too. Obviously, Krishna and Bridget here are on this panel. They happen to be admissions ambassadors for our office here. So although we don't necessarily provide like a stipend for research assistants or teaching assistants, students have worked in a variety of jobs. There's people who work at the help desk, they work in the library. There's a variety of different options.
I also just want to quickly mention, tutoring is completely free. for all students. It's a really great resource.
So the June application deadline, this is a good question, is for actually this coming fall. So it's kind of an interesting, Farmcast is interesting because they open in July for the next year. So the application has been open since July of 2024 to start in September of 2025. So that June 2nd deadline is actually for June of July, the fall of 2025. If you are thinking about applying for maybe a future term, maybe you're thinking of fall of 2026, you're just getting some information, that's great. The new application will open in July of 2025 for fall of 2026. I don't know the exact date. Typically, it opens right after the 4th of July. It's usually that week. It varies year to year because it just depends on how it falls. And the deadline, if I had to guess, most likely the deadline will be June 1st because it's usually right around that 1st of June. So just keep that in mind. Please do not start an application or even submit an application for this fall because unfortunately, if you do that, you're going to have to reapply. We need to, from a Farmcast perspective, have a new application on cycle for every year you apply. So if you were just like going to submit this to hedge your bets for next year, unfortunately, that's not going to work. We'll reach out to you. And if you're like, oh no, I'm interested in next fall, that's great. We're going to tell you to reapply. So again, only apply for the cycle that you're most interested in there. And if you have any questions, you can definitely reach out to me. Just give it a second here. If anyone has any last minute questions, no, it is for the fall of 2025. Everyone who is applying right now in the current Farmcast cycle is applying for fall of 2025. So just keep that in mind. It is confusing when you go on there because there is different start dates depending on the program, but everybody who submits a current Farmcast application will be for fall of 2025. So only apply if you are interested in starting this coming September. All right. Well, again, if anybody has any additional questions, you can feel free to reach out to Ryan or myself or Amy, depending on the campus, and we'll be happy to answer them for you. I want to thank the panelists here today. And if you are an international student, I just had a quick question come in. We do have an international team who is happy to answer any questions for you. So you can definitely get in touch with us and I'd be happy to put you in touch with the international team. That's a really great question because the international team is up to date on current visa requirements and everything that's happening with that. So definitely reach out to me and we'll be happy to answer. But once again, I want to thank our panelists here today and wish everyone a great night.